Crow of Colorado. Congressman, thank you for being here with us. Republicans appear to have the votes to pass this. What is the mood inside the Democratic caucus now that you're on the verge of losing this fight?
Pam, we're doing everything in our power to stop it and to slow it down. And the reason why slowing it down is really important is because House Republicans, congressional Republicans really, you include the Senate in that, haven't given Americans the opportunity to weigh in. They've stopped holding town halls largely. They're not responding to people's calls. They're jamming this through in the middle of the night, literally. They're bypassing committee process. They have short-circuited all the things that are built into a process like this to hear from people, to hear from constituents. So we're slowing this down, and we're actually trying to provide opportunity for them to weigh in. I've been spending the morning talking to my constituents, answering the phones in my office. Hakeem Jeffries is reading letters and outreach from constituents that are actually being sent in real time in some cases. We are listening to American people because that's really what's important right now.
What are your constituents saying, and what are your plans to protect them? Because you say that this will hurt the most vulnerable.
Well, it's not what I say. It's just the fact, right? This is the single largest transfer of wealth from the working class and the middle class in America to the top 1%, to billionaires. Not only that, it adds over $3 trillion to the deficit. It's going to rip health care away from 17 million Americans. It's going to blow up the health care system for everybody else. Even if you have a platinum Cadillac program, let's just say you have a great employer-sponsored program and you're not on Medicaid, just imagine what's going to happen when $1 trillion gets removed from the American healthcare system. Rural hospitals closing, clinics closing, doctors and nurses leaving the profession. It is going to blow up the system for all of us. We have just seen the tip of that iceberg. So what we're going to do is we're going to look at legislation. We're going to communicate about this. We're going to organize. We're going to mobilize. We are just getting started with our fight.
And the CBO does project that nearly 12 million will lose Medicaid coverage over the next 10 years. I'm wondering, what is the Democrats' plan for the midterms? I mean, you know, from what you lay out, it sounds like this could hurt a lot of Americans and could cause some blowback for Republicans. So how are Democrats going to seize that?
Well, first of all, I don't want to be seizing any opportunity like this. I just desperately was hoping that this would not be happening because, I've been talking to my constituents. I've been reading their letters, the fear, the anxiety. I mean, there are literally people that I'm talking to that I represent, Pam, who don't know if they're going to literally survive this. They can't pay for their health care bills, that have disabled children and the coverage for these disabled children, the care that they need to be able to work, to be able to survive, to be able to get basic care is going to go away. This is the most brutal thing I have ever seen in my time in public office. And that's my focus. And we're going to talk about it. We're going to fight it. I'm never going to stop so long as I'm breathing and here doing this work. And of course, the people will have a chance to weigh in less than 18 months on this devastation as well.
We just interviewed Congresswoman McClain, the Republican, in the last hour, and she said that the most vulnerable, like disabled children, they will be protected. And she said that Democrats are selling fear over facts. What do you say to that?
Well, she's lying. That's just the simple fact of the matter. I don't say that, in jest. I don't like saying that about my colleagues, but it's true. I mean, this is the fact of the bill. You're removing upwards of $1 trillion from the system. You're cutting off or reducing health care for 17 million. I have 175,000 constituents that rely on Medicaid. Over 100,000 of those are at risk of losing all that coverage. This is really devastating stuff, and it is just true that it's going to add $3 trillion to the debt. So it's not deficit reduction. It's not a pro-healthcare bill. It's not a pro-worker bill. It's not a pro-energy bill. It's going to roll back energy independence. And for what? The for what is to give massive tax breaks to billionaires and the large corporations, which is really what Donald Trump and this administration are all about.
Well, in addition to the tax cuts and the Medicaid cuts, it's important to note that this bill would also permanently boost the child tax credit to $2,200 depending on income, create government-funded investment accounts for every new baby, and then, of course, the no taxes on tips and overtime depending on income. Is there anything that you like in it, like those measures?
Sure, those things, listen, if they were to put up a bill actually with those things, I would have supported a bill with those things. But if you're not getting taxed on your tips, but you actually lose your health care, you're really in the hole, right? And all of the other cuts, the services, the food nutrition programs, and the shifts, the massive shifts of wealth, the top 1%, wipe out all of those savings for the vast majority of working folks. You know, I grew up in a working class family. I worked minimum wage jobs growing up. I worked fast food. I worked in construction to put my way through college. And, you know, it's the folks that I grew up with are the ones that are going to have to hold the bag here.
Congressman Jason Crow, thank you so much, and happy 4th. With news, more news when we come back.